Regenerative injection therapy is a cutting-edge, minimally invasive procedure that is designed to stimulate the body's natural healing response to treat the root cause of your pain. Here at the MaxWell Clinic, we utilize 3 different types of regenerative injection therapies. We utilize Prolotherapy, which is using dextrose and numbing medicine or lidocaine to stimulate your body's ligaments to get stronger and tighter. We utilize PRP, which is Platelet-Rich Plasma, which is essentially the growth factors from your blood, isolated by drawing some of your own blood, centrifuging the growth factors, and then we inject those into damaged tissue to accelerate healing of the injured tissue. And finally, we use structured tissue products, which are the maximal opportunity to heal the body through growth factors and attract your body's own stem cells to the area to begin healing, restoring, and regenerating cartilage, tendon, and muscle. RIT, or regenerative injection therapy, can treat a wide variety of conditions. Everything from arthritis in any joint in the body, chronic muscle injuries or acute muscle tears, tendon injuries. Any tendon in the body can essentially be treated with regenerative injection therapy. Cartilage issues in any joint can be treated with RIT. Some of the cartilage called labrum in the hip and the joint small tears can be addressed with that as well. Essentially, any musculoskeletal tissue, any joint in the body can be treated with regenerative injection therapy. But it's also important to note that the therapy assists in healing the local problem, but here at MaxWell Clinic, we also address the body as a whole. And so regenerative injection therapy is a part of a comprehensive plan in treating your musculoskeletal system. I started utilizing regenerative injection therapy more than 20 years ago, working as a team physician at a Division I college and with the U.S. Olympic and bobsled team. I began to see more and more athletes suffering from chronic injuries that did not have a solution in traditional orthopedic care. At the same time, I was getting all of the patients from my orthopedic partners that were failing traditional orthopedic care. NSAIDs, physical therapy, cortisone injections, and surgery all showing up in my office with persistent pain, degenerative conditions, partially healed injuries that were not able to be fully resolved with traditional medicine. This led me to start researching ways to assist the body in healing. I began attending regenerative injection conferences at the University of Wisconsin in 2003. Went on to get certified and trained in ultrasound medicine, using ultrasound as an injection. I also utilized fluoroscopy for injections. And over the years, started scaling from prolotherapy injections to PRP injections to stem cell injections, and now utilizing structured tissue products to really address the underlying root cause and assist the body in healing that root cause. Now, over the course of 20 years, I've treated thousands and thousands of patients from every walk of life, from royal families to professional athletes to Olympic gold medalists to everyday people. All of us are essentially athletes utilizing our bodies to get through our day. And these regenerative injection therapies have dramatically changed the way that I can assist people in helping them to get back to life pain-free. Today, most orthopedic offices don't offer regenerative injection therapy, partially because regenerative injection therapy is not taught in traditional medical residencies, but also because it's not covered by insurance companies. They'll cover a half a dozen cortisone injections that really don't address the underlying problem, but they're not covering regenerative injection therapy. Here at the MaxWell Clinic, we offer regenerative injection therapy because we believe that it's important to assist the body in healing, which allows you to return to your life as pain-free as possible. But also, regenerative injection therapies are part of a holistic treatment plan that addresses the whole body, assisting the body in healing itself through lifestyle interventions, through identifying any nutritional deficiencies, and looking at the musculoskeletal system for any misalignment, muscle weaknesses, or tightness that needs to be addressed so the body can begin to function optimally. There's a big difference between RIT and cortisone injections. Cortisone injections are really designed to be a very potent anti-inflammatory, and they do a very good job of that. If you have a swollen knee and they inject cortisone, it reduces inflammation very quickly and the knee will feel better. However, the underlying problem has never been addressed. So if there is laxity in the ligaments, if there's degeneration, it's only a matter of time before the inflammation comes back. Secondarily, cortisone damages the cartilage. It actually injures the cells that are responsible for building cartilage, chondrocytes. And it also damages the cells that are responsible for building bone, osteoblasts. And it injures the cells responsible for managing and maintaining tendons to tenocytes. So what happens over time with repeated cortisone injections, you actually accelerate the degenerative process because of the injury of the cortisone and because the underlying problem has not been addressed. So degeneration accelerates through traditional orthopedic care. Regenerative injection therapies address the underlying problem by supporting, regenerating, restoring the tissue, and creating a healthier environment so that the root cause of the pain is addressed and the body can move forward then without that persistent cause of damage, inflammation, and pain. The results from regenerative injection therapy really vary, and it varies based upon a number of conditions. One is the severity of the condition. 2 is the duration, how long have you had this condition. 3 is if there's any other issues that are contributing to the problem. This can be systemic, from systemic inflammation, from lifestyle issues, muscle imbalances, and so it's a comprehensive approach to develop a personalized plan for every individual case. Typically, it takes between 1 and 3 injections to really see significant benefits. Occasionally, it may take additional injections to really heal something that is much more significant or much more chronic. So a comprehensive treatment plan is designed for each individual, addressing the problem, and not only deciding on which injection is most beneficial and how many it will take, but looking at the body as a whole and addressing the other components of lifestyle and therapy that will help to fully resolve the condition. The benefit of using regenerative injection therapy is that there are very few risks or side effects. Essentially, we're using the body's natural response to assist in healing the damaged tissue. The general side effects or risks would include any time you put a needle or anything in the body, there's a slight risk of infection, but it's extremely low because we're using sterile technique and we're using very small needles. There's a slight risk of injuring other tissues, including muscle with the injection. However, because we're using regenerative injection therapy, anything that could be injured with a needle actually is allowed to heal because of the regenerative injection. That's about the primary risks of the regenerative injection therapy. As long as it's done by a qualified person who has experience with a needle, utilizing some imaging when necessary, the risks are extremely low of having any complications or side effects. When you come for a regenerative injection therapy consultation here at MaxWell Clinic, I want you to know that we treat you as an individual, and every case is a unique case, and we develop a personalized plan just for you. We address not only the underlying problem, the primary problem for which you came to the office, utilizing imaging, getting new studies, taking a look with the ultrasound here in the office to see exactly what's wrong, how long it's been there, and why it occurred, but also looking at you as a whole person, talking about lifestyle factors that really assist in helping your body to heal itself, looking at your body from the ground up and identifying any misalignment that might have occurred because of the injury or because of life, and addressing those through a really good fitness or physical therapy program, really to get the body in as good a shape as it possibly can be to heal and regenerate and then return you back to life, with the goal of that you'll only see me at the gym or at the farmer's market and not back here in the clinic unless you have another injury or need some help. Much of medicine today masks the symptoms of an injury. We're really talking about anti-inflammatory medications that reduce inflammation, pain medications that reduce pain, cortisone injections that reduce inflammation. And there are very few treatments outside of physical therapy and some of the therapeutic modalities that really get to the root cause of the problem. Regenerative injection therapy and our comprehensive musculoskeletal program here at MaxWell Clinic address the root cause of the problem. And when you identify that the root cause is torn or damaged tissue, and the regenerative injection therapy assists the body in repairing, regenerating the tissue, inflammation is naturally resolved, pain is naturally resolved, and then through a good rehabilitative program, any imbalances that occurred are also resolved. And so you're able to move on in life and not have to depend on any types of medications to treat the symptoms of the underlying root cause. So if you're interested in learning more or getting started with regenerative injection therapy, the first step is to call MaxWell Clinic and set up a consultation with me. When you come into the office, we'll spend time going through a comprehensive understanding of your problem, your story, and I'll develop a personalized plan just for you that will address the underlying problem, once we understand what that is, how regenerative injection therapy might be beneficial, and select which of those regenerative injections would be most appropriate to treating that underlying condition. We'll also talk about lifestyle factors that really augment or assist your body in healing, and then the fitness component of restoring imbalances in the body so that you won't have these problems in the future. Different than traditional medicine, we'll spend more than enough time to answer all of your questions and help you understand the best pathway forward and how regenerative injection therapy can change your life. So contact the office today, MaxWell Clinic. Go online, maxwellclinic.com. I have a page with a downloadable chapter. You can learn more about regenerative injection therapy. And I look forward to seeing you here in the office at MaxWell Clinic.